Welcome, doctor, and thank you so much for this live session today. Yeah.
So I'm so happy that you chose a topic like this because there are so many questions,
Yeah.
especially people who are trying to keep themselves
Yes.
healthy and people who are with you
Yes.
who would
Yes.
probably would like to get cleared.
Yeah.
And I'm happy to help
Thank
whatever
you.
I can.
No, thanks for your time, doc. So everyone, I would like to introduce Dr. Shashi Ranna to our live session. She is an MBBS MD into obstetrics and gynecology, and she has had her education from BJ Medical. So she's from Pune, and she's the owner and founder of Ranna Hospital, and she is right now the chief executive officer and the main obstetrician and gynecologist, and she has an experience of over 35 years. She is also uh, her expertise lies in laparoscopic obstetrics and gynecologic surgery, and she's also an expert in high risk pregnancies, and of course today's topic, which is polycystic ovarian syndrome. So yeah, doctor, welcome. And actually, the first question that I wanted to ask you is right now, how is it going? I mean, right now with the whole COVID-19 or the coronavirus situation, how is it going with you?
Yes. It's a tough situation because we have the pregnant patients. These are the people whom we are very concerned about. So
Yeah,
because of the lockdown, they are unable to come for checkups regularly. And pregnancy is a thing where there is a limit about what you can see the reports online, you can chat online, but what we really need to do a lot of hands-on, check the baby's heartbeats, check the BP. So we really are struggling to plan things so that the patient is safe and she's safe both pregnancy wise and also from getting the infection.
okay,
So it's still in process how exactly we will be managing these things.
okay. So,
It's
so,
working out.
so your hospital is functioning right now.
Oh yes,
Okay.
because we are considered an essential service.
Mhm.
Deliveries happen anytime, all the time. We can't shut down.
Okay. Yeah, yeah, doctor. Okay. And could you talk a little bit about the type of patients you consult and the usual issues that females have nowadays?
So obviously, I'm seeing all female patients.
Mhm.
So either they are pregnant or they are not pregnant.
Mhm.
So these are two very different kind of streams. The pregnant ladies are, anxious about babies are growing well, their health, and fears and misconceptions about delivery. This
Yeah.
is over and above our routine checkups and the things that we do for them.
Mhm.
So this has to be addressed and this has to be advised properly. Not only the treatment, but also how to keep themselves healthy, food wise, activity wise. We have people who are homemakers, people who are career women, people who are professionals, people who have no fixed time. And then we have the IT people whose biorhythms are like way out of range.
Yeah.
They are awake at odd times and so we have a whole range of people and each of them requires a very tailor-made kind of advice and treatment.
Correct.
Then
Yeah.
we have the non-pregnant ladies.
Yeah.
So they have worries, if they are in the reproductive, what we call reproductive age group, which is between 18 to 40, 45.
Mhm.
They have a lot of concerns, mostly about their menstruations, mostly which are usually related to the hormone changes.
Right.
Also, we are in 45, there are different kind of hormone changes. So both of them are related to uh, again, I would say how active they are and how well they are keeping themselves
Right.
mentally and physically.
Right. Right. So, doctor,
A lot of it also genetic, yeah.
yeah, and you used a very interesting term then called biorhythm. Could you please explain us more about that?
Yeah. So, as you know, we are the part of the solar system.
Yeah.
Earth is just a tiny speck in the solar system. The whole of life on earth is very much dependent on the sun, and we have this 24-hour day and night cycle.
Yes.
So right from when evolution started, when microbes and then the basic life forms, then the animals, we are all attuned to the sun.
Yeah.
That is how our systems work. So we have surges of hormones and steroids at certain times of the day,
Yeah.
and then again dips at certain times of the day. This depends entirely on the kind of sunlight that you're receiving at that time
Correct.
in that geographical area.
Correct.
So our bodies are attuned to work that way, and
Correct.
this is a very ancient system.
Yes.
When you disturb that system, the bodies will malfunction. Your
Definitely.
systems do malfunction.
Definitely.
And then you have things like, stress related,
Mm.
what we call Asian syndrome, where very young people have heart attacks, and
Mm.
you have early onset diabetes. You
Yes.
have all those things that normally it used not to happen
Yes.
till a generation or two ago.
Okay. And doctor, actually, in the last 5 years, there has been a surge of cases or teenage females who are. I mean, there are many members who we are currently supporting, who have got this something called as PCOS, and I call it something because
Yeah, right.
I don't call it a disease. So
Right.
they come
Yeah.
diagnosed with PCOS.
Yes, this is a very this is a very common diagnosis nowadays that we see, but it's a whole range of symptoms. PCOS is not one thing. There's it can present in so many ways,
Yeah.
and it's once again it's not something that you're labeled at PCOS and you're done. There's nothing that
Yeah.
you can do. It's a phase. You can go into a PCOS and you can come out of it also.
Correct.
A lot of it depends on what was your basic health,
Mm.
what you're doing about it, and further what you want to do. Whether you want to, depending on whether you're trying to have a baby or not, the treatment will vary according to that.
Correct. Correct.
So PCOS is actually, it's as yet there is no known single factor for PCOS.
Correct.
But one common thing among it is that there is, if I were to call it medically, it's called insulin resistance.
Yes.
And that causes a lot of changes in the body.
Yes.
And people are trying to find out why this happens.
Yeah.
And a very important thing about it is that there are enzymes or there are chemicals produced in the body
Yeah.
that will affect your hormones and then affect the PCOS.
Definitely.
So PCOS, I think, Omkar, you know what that is. And I don't know whether the people who are listening know what is exactly PCOS.
Yes. Yes. It is like a syndrome, and actually, I really liked because you took up insulin resistance, because the root cause of PCOS, or many cases in PCOS which is seen nowadays, is high insulin levels or high glucose levels in their blood. Because every
Yes.
time, yeah,
So this is connected very much to
Yes.
what has been your food habits before.
correct,
It's not just and your activity. Because
Right.
if you have been eating a lot of processed food right from childhood, if you
Correct.
have been inactive, the
Correct.
pancreas get used to that kind of stimulation.
correct,
And then the body stops listening after some time.
yes,
And yes, and there is no effect of, trying to bring in, but you won't have a quick effect on that. Because there is insulin resistance, there is a feedback on the other hormones that then act on the ovary, and then it stops working properly, stop
Correct.
ovulating, your menstruals get disturbed.
correct,
But there are two things that are very much in the person's hand, in your hands, that you can do.
right,
One is watch your diet, and second is be active.
yeah,
Be active. The scientific basis for that is that there are chemicals called myokines
yes,
that are released from the muscles as you work, and this will help the insulin resistance to come down.
Correct.
Once the insulin resistance come down, then automatically you start burning up
Right.
whatever you don't need to keep.
Correct.
And you don't have that craving to keep on eating, you're not satisfied.
right, right,
It's a lifestyle disease, in short, PCOS.
Correct.
Basically, this is what we can call it.
correct, correct,
And this
so-
is a very prolonged kind of disturbance in the lifestyle.
right, right. And so many females actually come with this pre-notion where they say that, oh, I've got diagnosed with PCOS, and then they think it's the world ends there, and they are diagnosed with some kind of disease
Yes.
which they can't come out of.
No, it's not at all like that. It's
Right.
just a phase. You can come out of it. You
Absolutely.
need to put in the effort.
Yeah.
You don't need to take a lot of hormones. You don't need to take a lot of medicines, but you need to be very, very motivated to be particular about your diet and particular about how active you are.
Definitely.
As far as it is in your hands. Because why I'm speaking about the IT people is because of their jobs. They
Yeah.
probably find it very difficult to do this.
Yeah.
But somewhere this has to be worked out for sure.
Yes. Yes. Absolutely.
So once you are about diet, I would say avoid all processed foods. Absolutely. Anything that comes in a package and ready made is just out.
Yeah.
Use as much fiber as you can, and of course, proteins.
Yeah. Yeah.
These are the three things. Fats are not bad.
Yeah.
You can definitely have.
Absolutely. Yeah.
And active. You basically need to do the cardio. You need to do all the muscle squeezing
Strengthening.
exercises.
Correct. Correct.
And that will help the whole system to come back to normal, and it will have the feedback on the ovaries.
Absolutely. Yeah. And
What actually happens nowadays is that right from childhood, because in school itself, children are so they are driven, from to do well, to have so many marks. That seems to be the aim of every parent. It's a good thing,
right.
but it has to be balanced. What happens is that you go from school to class to another class, and then there's no time for a sit down proper meal and no time to go out and do something active.
Correct.
And this finally tells on the system.
Right.
And when it started at a young age, the effect goes on.
Right.
But PCOS is definitely a dealable thing. It's not a label that you can. It's stamped forever.
It's not a tag for life that someone would live by.
Not at all.
Yeah, absolutely. Great. And doc,
there is a place for medicines, but 90%, I would say at least 80%, will have an excellent response just watching your diet and
lifestyle. Correct. And doctor, there are many females, especially in the working in the IT industry, who work in shifts. So week 1 is morning shift, week 2 is second shift, and then third, and they keep changing their sleep cycles.
Right. Yeah.
Do you also see a lot of cases with hormonal issues who work in shifts?
Absolutely. I would say not only females. This is they definitely have a lot of problems.
Yeah.
In gynec-wise, health-wise. But another thing that we have noted among couples who are IT couples and trying to conceive, even the men have a very low sperm count or not a good healthy kind of sperm,
Correct.
not a good amount.
Correct.
So it's working on both, not just ladies. Yeah.
Correct. On males as well.
Yeah.
Right.
Yes. Yeah.
And do you also? I mean, now I'm going on the next topic, which is related to pregnancy. So first, we talk about pre-pregnancy. There is a tendency, especially in our country, where whenever a female is pregnant, then she is fed tons of food. And that tons of food also happens to be a lot of sugar, a lot of processed food, which is very high glycemic index carbohydrates. Now that does have that has an emotional connect where grandmothers and mothers come and feed them, but I think personally that it is high time to educate people to eat the right kind of food, especially during their pregnancy time.
Now, not at all. Absolutely not. All those let her eat because let her craving be fulfilled. That kind of thing doesn't make sense. I'm seeing more and more people who are developing gestational diabetes, that is diabetes connected to your pregnancy, which has a bad effect on both mother and baby. So as soon as most doctors, as soon as they find out, as they've diagnosed the pregnancy, will give you a diet chart. What are the healthy things to eat? What are the things you should avoid? And hopefully patients are following that.
Right.
Sweets are nothing. It gives nothing. Not now.
Yeah, absolutely. And whenever, again, just like the tag which people have with PCOS or with some females have with PCOS, there is another tag where females are okay about being a diabetic. And there is a huge amount of people who are just okay having metabolic issues. And I keep repeating always that you should not be okay about having a metabolic condition. And I'm not talking in a negative way. I'm talking in a very, very positive way where not saying okay helps us fight that particular metabolic condition and become normal again.
Yes, I totally agree with you, Omkar. It's not something that you can sort of helplessly say, oh, okay, it
Mhm.
happens,
Mhm.
and it was with my family, we are all diabetic.
Yeah.
It's a sort of, chalta hai, which
Yeah.
finally very easily leads you down the road to early heart attacks
Yeah.
and all the other problems associated, which is totally avoidable.
Yeah.
You can have a good life. You
Mm.
should have a good, healthy life. But
Mm.
diabetes can cripple you in so many ways.
Yeah.
It's not something that you should just accept and move on.
Great. Absolutely. Yeah. So, to conclude, the importance of maybe eating right, sleeping right, exercising is paramount when it comes to chronic conditions. And
Absolutely.
yeah, and another, I mean, question that I wanted to ask you is that have you ever have you ever seen females actually facing a lot of issues related to their mental health because they are stuck in a particular condition like PCOS or diabetes?
PCOS, I feel, more than diabetes, because
Hmm.
diabetes is a well-known thing. People are aware that, okay, my father had, my grandfather had, so it's nothing new. But PCOS has become the new, bugbear or the new
Hmm.
thing to scare people with.
Yeah,
Actually, as a doctor, I'm saying this, that
yeah,
it sometimes is made into a more scary thing that it actually is. Because of that, I see a lot of young girls, like you said, who are so terrified that they got PCOS. It's like some incurable disease, which is
yeah,
absolutely the wrong thing. It
correct.
is not a disease, it's just a situation. It can be dealt with, and it can be very simply dealt with. It
Yes,
may not be, yeah.
yeah,
So I think, Omkar, you're on the right track by saying food and
yeah.
activity.
Thank you.
These
Thank
are the
you.
two things that
Yeah,
absolutely need attention.
yeah, yeah. So I'll just look in the comment section and see if anyone has any questions
Sure.
to ask. There are actually a lot of females today who have joined in this live session.
Oh, good.
Yeah.
Yeah.
Guys, if you have any question, you can ask. I'm trying to scroll and find a question. Females, especially if you have any questions related to PCOS or pregnancy or the lifestyle issues related to that, you can go ahead. Yeah. So I guess there is one mainstream medicine is all about giving you disease labels and drugs accordingly. It's something a guy has mentioned.
Right. Okay. It's not showing up on my screen.
Mhm.
So he feels medicine itself is scary. Is
Mhm.
Yeah. Well,
What is the reason
such
behind cramps
doctors.
and what is the cure?
Okay. What is the reason behind cramps and what is the cure? Right, the reason behind cramps is that there are certain chemicals which are released when the bleeding, just before the bleeding starts and
Mhm.
during the bleeding, and that acts on the muscle of the uterus and causes it to contract very hard, and that irritates the nerve ends in the uterus, and you feel the pain. Uterine contractions happen in all periods, but these uh, make the nerves more sensitive, the muscles more tightly cramping. There is a muscle in the uterus. Uterus is made of muscle fibers,
Mhm. Okay.
and those are contracting hard, and so you get cramps. You
Okay.
can just take a simple antispasmodic, that's all it needs.
Okay.
Solution for cramps.
Mm.
And also whether PCOS has some impact on our behavior due to hormonal changes. Yes, it's likely hormones do affect your mood, definitely. And since PCOS has, swings of hormones or, a whole clash of androgenic and estrogenic hormones, you can have moods of behavior. And the solution for cramps is very simple. You can take what are called antispasmodic. You can meet your doctor and anyone would be able to give you a tablet for that. There's no permanent solution.
Okay.
They usually gradually decrease as you grow older.
Okay.
If it's still increasing, then you need to go for a full checkup.
Okay. And doc, when it comes to female hormones, FSH and LH are the two hormones which are, which are the two highly or mainly studied hormones, right? Like follicle stimulating hormone and luteinizing hormone, the two hormones.
Right. Yeah.
So those are also connected to insulin, correct?
FSH and LH, almost all the hormones are connected to insulin.
Yeah. Okay.
Yeah, but FSH and LH are actually under the control of another hormone called GnRH, gonadotropin releasing hormone. Those are more powerful on FSH and LH than insulin.
Okay.
Insulin will just what insulin does is I'm going very much into biochemistry now. It acts on 3-4 different levels. It acts on the cellular level, it acts on the blood level, and it acts on the muscle level.
Okay.
And all of these are precursors to the what are called androgenic and gynogenic,
and
male and female hormones.
Okay.
And if that insulin has been too high anywhere, then very often you get more androgenesis in females. And then you see the hirsutism, where you have facial hair and male pattern baldness and things like that.
Right.
So more than FSH and LH alone being the problem, it is insulin acting on the other tissues that cause clash between the normal cycle and the other hormones.
Okay. So then it's like a cascade in the body. So the first mover is...
Exactly.
Okay.
Yeah.
Got it.
So, and this insulin is creating, blocks in the normal cascade.
Okay.
It prevents the normal flow and feedback.
Okay.
It's a cycle. Yeah.
Okay. For people who really want to read up on insulin, you can. Just to mention out there, based on or something which is applicable for you guys, your exercise does have an impact on your insulin levels, and so does your nutrition. So when you're eating, as doctor mentioned, a lot of processed food, like a lot of carbohydrates, then your body is bound to produce more insulin. And that then is the root cause of all these hormonal issues. Okay.
Right.
Yeah. And doc, one last thing. What is if you want to give a message to all the women out there and all the females out there currently, what is the message that you would like to give on this live session?
Right. Be active, be healthy, and be positive. There's nothing that you can't beat.
Yeah. That's a big one, because females won't just stay with this tag called as PCOS or anything like that.
Right. Yeah. You're more than the tag.
Yeah. Great. Okay.
All right.
Yes. Yeah. If anyone has any more questions, you can ask them.
Ask one last question which I couldn't understand.
Okay.
What is BCCA? Well, I hope, they're welcome to ask you or me. I could answer anything.
Yeah, definitely. Yes. So thank you so much, Doc, for giving your time. Thank you so much. Sir. By the way, guys, Dr. Shashi herself is a very, very good, she's very good into exercise. She, Shri trains her. She is into strength training. She takes care of her body very well. And she also plans her nutrition very well for the day. So she's leading by example, guys. And that's one more reason why, if anyone wants to meet her, you can meet her. So you can reach out to her profile, or maybe you can message me and I'll connect you too.
Sure.
Thank you.
Please do that, Omkar.
Thanks
a lot. That's kind of you to say so. Bye.
Bye. Thank you.